Good afternoon, everybody, and welcome to the first of 3 ACYPL virtual town halls focused on how the public education system in the United States has been impacted by and has reacted to the COVID-19 pandemic. During this 3-week series, we'll explore the many challenges that communities across the country are facing as a result of schools closing their doors, thereby forcing students, families, teachers, and administrators to adapt to distance learning essentially overnight. We'll discuss everything from funding and grading to the academic calendar, and we'll ask questions about preparedness for distance learning, what policies are under consideration to improve the system, and what the future of K-12 could look like in the fall of 2020 and beyond. Today, our conversation will be centered around the issue of equity. We'll examine how COVID-19 has dramatically exposed the inequities in society within the education system, where educators are struggling to access all of their students at a time when distance learning is the primary, if not only, way to learn. There's a lot to discuss, and here to answer your questions and share their unique insights on the subject is our panel of experts. The Honorable Quentin Phipps, member of the Connecticut House of Representatives and Director of Advocacy and Policy for Excellence Community Schools, the Honorable Miguel Solis, member of the Dallas School Board, and the Honorable Stephanie Summers, President of the David City, Nebraska Board of Education. Speakers, I am delighted to have you here today, and I'm hoping that our time together will be conversational, so please feel free to talk among each other and ask each other questions. Before I get ahead of myself, though, would you please introduce yourselves and share your background in education and in elected office? Q, let's start with you, and then we'll go to Miguel and Stephanie.
So thank you for that introduction, Jacqueline, and thank you to ACYPL, who has been a major life-changing organization for my own life. So I appreciate the opportunity to not only just see the world, but to present about some of my passions, which is definitely equity in education. So good afternoon, everyone. I am Q Phipps, State Representative for the 100 District of Middletown, Connecticut. So we are equidistant from Hartford, the capital, and New Haven, the home of Yale. And we're also equidistant from New York City and Boston. So I can get to 2 hours to both. So in my district in particular, I am actually the first Black state representative in Middletown's history, which is a 200-year history. I was the first African-American to serve in this role. And our city as a whole and district is very reflective of the overall demographics that look very similar to the United States. So when you think about a type of middle America, or one of the many middle Americas, my hometown, Middletown, is just that. So when we talk about the equities, I really want to be clear that these are issues and concerns that many of us have been talking about for a while. And when we talk about inequity, we're talking about several things. We're not just talking about the grading or looking at the differences between standardized tests between some of our students and others, which is a big part of it. But we're also talking about how numerous of our students, when they go to school, their bellies are empty. We're talking about the many students that when they go to school, they haven't had reasonable health care, whether physical health care or mental health care, before they even walk into the building. We're talking about folks that may have been witness or participants of violence as they even get to school. These are the sort of inequities that the COVID virus has only put a spotlight on, but many communities have been relaying about the concerns and the pain from that work. So I wanted to kind of put the context of both my district that I work in and also the district that I serve, and kind of give like a tale of multiple worlds. So there's about 60 miles away, the school that I work for is a suburb of New York City, essentially. And to get to work, I have to get through my entire city, where I see many of our Wesleyan professors, which is pretty much like a baby Ivy, or little Ivy is what it's called. And you're seeing gigantic homes. Only to drive through, once again, one of our most least affluent, where home ownership rate is probably around 3% in the entire area. The highway is right next to their homes. So you see large disparities in things like asthma and high blood pressure and other respiratory issues, only to get to the highway and start to drive this 60-mile drive. And right before you get to the school, I said it was in a small community school, and the first community school in this area in over 20 years. And I want us to, when we think about the inequities, a school is more than just a place to be educated. It's a social engine. It's a safety engine. It's a political engine. It is an educational engine. It's a job engine. It's an economic engine. It's all these things. And when a community doesn't have that for 20 or 30 years, what does that do to everyone that lives in that neighborhood? But before I get to my school, I have to drive through several towns. New Canaan, Greenwich I don't have to drive through, but New Canaan, Darien, Fairfield, some of our most affluent areas in the entire US. And in particular, one of those areas, my phone stops working. So every time I drive through it, I get terrified that if I ever get pulled over, my phone won't work. So these are just some of my own issues that I have to do just to get to work with a population that we're going to actually go through some of the slides right now. If we can, if we can go to the first, actually the second slide.
Hugh, I wonder if we might be able to introduce Miguel and Stephanie.
Oh, I thought we're doing the whole thing from the beginning. I'm so sorry.
Not at all. Thank you for sharing that.
Okay, so I'm gonna stop and then we're gonna go. I apologize, messed it up already.
No, not at all, not at all. Thank you. Miguel?
I was loving where you were going with things, man. I was ready to just
I know.
Slides as well. No, so my name is Miguel Solis. I'm a member of the Dallas School Board. I recently completed a trip with ACYPL to Croatia and Hungary and learned quite a bit. I will quickly reiterate what Q said from the beginning. ACYPL has meant quite a bit to me, and I'm really thankful to have had the opportunity now to kind of give back and exploring the issues of equity in education, specifically as it relates to COVID. I'll talk a little bit about Dallas ISD in a second, but the bigger issue that I think that you should know right now when it comes to our city is that we're a city that is still, I think, healing from the racial wounds that have manifested over the course of many, many, many years in our city's history. And COVID has exposed quite a bit and has charged our community with doing more to ensure that we can close those inequity gaps. So really excited to be a part of this conversation. Jacqueline, thanks for the invitation and looking forward to it.
Thank you. Stephanie?
Hi, I am Stephanie Summers and I'm from David City, Nebraska. So I have been on the David City Board of Education for almost 10 years. I'm currently serving my 10th year. And I have been president for the last 3. I received a bachelor's degree in education in mathematics, 7 through 12. And I have a master's degree in math education as well. I've taught in public school in both Nebraska and Colorado, as well as the community college level too. I substitute currently at both the public school and the private school in our community, and I'm really excited to be a part of this discussion. ACYPL have really kind of catapulted me into an area of my life that I didn't even really know existed until I went on the China trip last June. And I will be forever thankful for the phone call to ask if I would go. And also thankful for all of the friends I've met on my trip, either from the United States or in China, who I still keep in contact with through social media. So thank you, and I'm really looking forward to the discussion today.
Wonderful. Well, thank you all so much. Now let's go ahead and pull up the slides that you've prepared, which will detail information about the districts that you represent and will speak to the inequities in education. So let's go to the next slide, and Q, we'll start with you.
Perfect. Since I already used my first 6 minutes, I promise I only have 4 more left.
No, please take your time.
This is what happens when you give a legislator the mic. They'll take it and they'll never give it up. To just look at the mission really quick. So essentially what the school that I work for, that I talked about that drive and how to get to work. The goal is to help students that need the help the most. So students of color, students of low affluency, students with special education needs. Those are 3 of our primary targets of who we go to work for in the school. If we can go to the next one. So you see the demographics of the school. In particular, the city that I work in, Stamford, Connecticut, was essentially a suburb of New York City. Most of our families and most of the community will work in New York City related fields. So if you can't afford, typically not being able to afford New York City, which rents can be anywhere from like $2,000 to $2,500 starting, our area is significantly cheaper. Not cheap, definitely not affordable, but significantly less than New York City. We can go to the next one. So once again, some of the clear things, and I want to highlight in particular the National Blue Ribbon Award winner. That's one of the highest achievements that you can get from the State Department of Education. So I'll give that for a moment. But the reason I talked about that drive and why that drive is so important is that before our students even hit the classroom, they have oftentimes surpassed and thrived through tremendous amounts of trauma before we even start to ask the question, like, how are you feeling? Or are you ready to learn? And I think about the many of us that if we didn't have our coffee in the morning, our entire day would be ruined. But what we've asked for students in the middle of a COVID crisis, where they probably have seen deaths of family members at a disproportional rate, they have seen their parents have to work more hours because a lot of their families will work in the medical fields, nursing homes, that sort of work where they're essential workers, so their families are gone. So now they're essentially being helped be raised by older siblings. It is just tremendously traumatic to have to go and learn in those particular ways. But I want to highlight this particular field in this particular slide, and here's why. Our commissioner, we just received a new commissioner of education, Commissioner Cardona, someone that I'll say was a big fan of, that talked about inequity at the very beginning of this COVID crisis. He said, if we do not make change after this global pandemic, we will never, ever make change. And then 5 minutes later, he talked about respecting home rule. So in other words, when you have, in Connecticut, we have 160 plus different school districts. We can't talk about the inequity of a system and then also say that we are going to respect the ability for particular districts or small towns or cities to be able to have different rules than everybody else. Because that's literally what the inequity is. And in this particular slide is why I want to highlight why it's so important. So right now, our highest grades are up to the sixth grade, or excuse me, up to the fifth grade. Because of the COVID virus, they have eliminated our middle school, so 6th through 8th grade. So the students that you see from Stanford Excellence that have over an 80% chance of reading at grade level and over a 90% chance of being at grade level in mathematics, those children are now all going to be asked to go to a school where they will only have a 40% chance of being at grade level. So they could be at a place that they know that they're going to be successful at, and because of the COVID virus and finance, that has been eliminated, and now we're sending them back to a chance where they only have a 50% chance of doing well. These are the sort of inequities that the COVID virus has brought to light, and this is the sort of conversation that we're looking to find solutions for. So let me pass it over to Miguel to talk about what's going on in Dallas.
Yeah, thank you, Q. So yeah, I think it's first important to note that in Dallas ISD, we're the second largest school system in the entire state of Texas. We are in the top 20 when it comes to largest school systems in the nation. And the population of Dallas is, based on, I think, the most recent statistics, makes it the 9th largest city in the United States. So we're dealing with a lot of kids in our local public schools. To be more specific, though, we have 154,000 students. 70% are Latinx, and of that 70%, many of those children are undocumented students. And so today, is obviously a really big day for the undocumented population, particularly related to DACA status. But we have many undocumented students in our Latinx population. We have 21% African-American students and then 9% other. The district overall is qualified as a 91% impoverished district. And so what that essentially means is 91% of our kids are under the federal poverty line and qualify for federal free or reduced lunch program. From a staffing standpoint, we've got about 23,000 staff members, and our budget overall is a $2 billion budget. So it's a very large district. But I want to dig a little deeper and think about the academic achievement dynamics. We have a large academic achievement gap, and that we're continuing to close, but it's still significantly large. And it's even worse when you break that down demographically. Our African-American students are significantly behind from an opportunity standpoint, somewhere near the lines of about double-digit gaps in the areas of reading and math specifically. So we have seen some dramatic inequities prior to COVID that we've been trying to work on, but COVID has presented even more of a challenge in trying to address these issues. If you can go to the next slide. This is what attempting to address COVID has looked like since we closed our schools towards the end of March. We have 223 schools in DISD. I told you we had 154,000 kids, but about roughly 150,000 of our kids we've actually had contact with, and we are interacting with these students through virtual learning, and I'll talk a little bit more about what that looks like in a second. That gives us about a 99.3% enrollment with students that are connected with our actual teachers. But we've had to do all sorts of things to get in touch with our kids. We've had our teachers do things like reach out to them by phone or email. Our teachers have begun to utilize things like Microsoft Teams and Zoom, not just for their interactions with their colleagues, but with our students as well. And then additionally, we've had to deploy our administrators and counselors to do extra work in keeping up with families to try to address not just their educational issues, but their issues related to socioeconomics as well. Additionally, we've asked our Dallas ISD Police Department, which is our own internal security department, to work in interacting with our kids as well. Two major things that have come up as a result of this work, if you'll go to the next slide. The first is around technology. So we have actually had to do a huge effort around getting kids access to the technology they need to get back to somewhat of a regular educational experience. The good news is that prior to our district closure, we had been deploying devices to our students. 70,000 of our kids had access to computers and had access to additional technologies, and 12,000 of our teachers had access to this as well. We also had about 8,800 mobile hotspots for our students who needed to use technology when they were at home because they didn't have access to the internet. But since the district is closed, we've additionally added 45,000 devices for students to be able to learn and 23,000 mobile hotspots for our students as well. If you go to the next slide. The final thing I want to talk to you about before I turn it over to Stephanie is food. So one thing that became very clear in not just Dallas, but across the nation, is that students rely on food, and it's essentially the food distribution for a significant amount of our kids that are stuck in poverty. So to date, we've served over 6.4 million meals to our kids who have needed this. We've had to rely on our additional staff, custodians, volunteers, substitute teachers to be able to distribute these meals, and we've done it over 43 campus sites across the district. On top of that, we've also had to work with our homeless department, but because we've got about 4,000 kids that qualify as homeless who also need access to this food, but don't actually have access to the mobility necessary to be able to get to these sites. So we've had to get really creative in partnering with our city and our transportation system as well to get this stuff to our kids. I'll stop there and close by simply saying technology and food have actually been the biggest disparities that we've seen, but we're beginning to now see additional disparities like learning loss and what that means for those kids who already had academic achievement gaps. And now we're going to be faced with a significant need, a significant set of resources to fill the need of the academic learning that has happened, lack of learning that's happened over the course of the past few months. So Stephanie?
Thanks, Miguel. Thank you very much. And thank you, Q and Jacqueline. So I'm in David City, Nebraska, and I thought everybody would appreciate a little map to let you know where we're located. We have a community of about 3,000 people, and I don't think it's ever gotten over 3,000 since it was settled in the 1800s. The median household income is 50,000 and some change, which is up about 10 years ago, maybe 15 years ago, it was more in the 30,000 range. David City has two school districts. One is the public school system and the other one is a parochial school. And we serve very similar populations. I shouldn't say similar populations, but size of student bodies. So our small community is very much split down the middle on the school sizes. We actually compete against each other in sports and in other school activities. So it creates a very unique community dynamic. We can go ahead and go on to the next slide and talk more specifics. Our student population is 46% economically disadvantaged. We see a lot of rural poverty in our community, meaning just less services, less job opportunities, less support for those with disabilities. And we're always looking outside of our community to try to find resources for all of those. What rural poverty, the complications that rural poverty brings. We also have some generational poverty as well. Our special education student population is at 21%, which is significantly higher than the state average. Again, we have to travel and we have to have our kids in vehicles for long periods of time during the day, during the school day, to try to get them the services that they need, just due to our location. And we all know that that is one of the highest need areas in a school, is the amount of money that needs to be put into a lot of those, to educate a lot of those students. And it's just almost impossible for some school districts, especially the rural ones like ours, to support all of those needs. So we have to look elsewhere for that. We have 14% minority. Our high mobility students are a specific challenge for us, because with the community and the economics that we have here in a very agricultural state, we have a lot of students that are moving in and out of the district based on the agricultural cycles. And so we might see a student for 1 or 2 months out of the year every single year, or we might see them for 3 months or 4 months every other year. It just completely depends. And so we have to take them when they're here and do the best that we can, and and we always hope that they stay, and but of course they move on often with their families. One other thing that I wanted to point out was that transportation costs for David City, Nebraska are very high, because we serve a 504 square miles of, our buses run 504 square miles to pick up our students each day and to take them home each day. So that is another one of our areas, is we just have a lot of students that are all over the place, and getting them here safely is a huge concern of ours as well. We can go on to the next slide and I'll talk a little bit more about the state in general. Our numbers really aren't that different from the state as a whole. We're right on average for the economically disadvantaged. Our special education, that I said, was, we are significantly higher, and the minorities population for the state is significantly higher than for David City. One of the things that I think is interesting for our state in particular is just the fact that we have our largest school system in the state is Omaha Public Schools, and they serve a little bit over 50,000 students. Our smallest school district in our state serves 64 students. And there are 67% of the districts in our state serve less than 500 students. So you think about, we have a few urban areas in our state, but most of our state is extremely rural, and the distances that districts have to maneuver in order to serve their students, whether that be picking them up on a daily basis and taking them home safely, or just providing services for career opportunities or higher education, trying to get dual credits and distance learning, or like I said, trying to meet the needs of those special education students. So there can be a huge inequity in the fact that you are very remote and you just don't have the services available, and you're trying to provide a level of education to students that their counterparts will get in other areas of the state. So with that, we'll go ahead on with the discussion and kick it back to Miguel.
Yeah, Jacqueline, I don't know, maybe you can transition this.
Yeah, no, thanks so much, all of you, for sharing this information. I have a question I'd like to pose. You all have mentioned the digital divide. I'm wondering if you could speak a bit more to how it has impacted special education.
Yeah, from a Dallas ISD standpoint, Jacqueline, it has been probably among many struggles, our biggest struggle, trying to figure out how do you take what is such a nuanced craft. I mean, the pedagogy of special education it's so esoteric. Like you're talking about individualized education programs that, you know, are tailored to one specific student, that take a team of people to work together on to ensure that that kid gets what they're due by law. How do you do that over a computer? And then, like, to compound the issue, what if you're a student who's qualified as special education, but then also has things like a physical handicap and need occupational therapy or physical therapy? These things are extremely difficult to try to handle over the virtual platform. And in some ways early on, were essentially just, they weren't done. And we were having to work through how we would get our team of professionals in a place where they would be providing support. I can tell you that we've advanced significantly in figuring out how to provide those supports, and are at the point now. It happened to be that it was towards the tail end of the school year, so there wasn't a huge progress that was made there. But I know that our administration is now trying to think about how we create perhaps some hybrid model where we've got our special education population access to the physical structures, or our people, our human capital, access to the population, so that we can actually advance their education.
I'll go ahead and speak to, for how the COVID transition or transitioning into the COVID way of teaching for our special education students. We are very, very grateful to all of our special education teachers and the paras that work with those students, because living in a small community as we do, they were able to either have, for some students, one-on-one Zoom meetings, or they would go to their house and have social distancing outside, or they would try to work with them one-on-one to help them with any of the material that they needed help with. One of the things that we have to discuss as a district is, what do we do with those students who cannot be in a regular classroom, or cannot be, or their educational goals are not anything that's ever going to be considered through online learning. They're not going to be resolved that way. So what happens, a lot of our students are served through our educational service unit, and that's 30 miles away. So they get bused up there during regular, normal time when we're in-house. But how do we serve those students when they have to close down because of any possible closures that might happen in the future. How do we serve those students in our building or remotely? So those are conversations that we're having, but we were very grateful during the COVID, the closure, to have our special education teachers have the ability to reach out to the ones that we were able to reach out. And we have a lot of compensatory education that we'll be doing over the summer to try to get those students ready for the following school year.
Yeah. And this, I think that the virus clearly also showed some of the things that we called truisms before weren't quite so true. So what do I mean by that? One, we always said that it wasn't affordable. It was not cost effective to have individual education plans for everyone. But this clearly shows, given that we didn't know who had access to computers, what time people's family lives were structured. Everyone needed a plan that worked for each individual student. And if we are going to make sure that all students can learn and have access to education, we are going to have to make an educational process that is individualized to making sure that every student can work. I think we also illustrated that you can't just take one model for students. In other words, whatever you did in the classroom before on Monday, now we're just going to put it on a Zoom and now everyone's going to learn. That clearly doesn't work, right? So we also shouldn't be surprised that when students in traditional settings weren't all doing great either. Did they need a different pedagogy style? Should they have done New City? Should they have done Montessori? Should we have had other ways of teaching from the very beginning to make sure that everyone had a fair shot? And I think this COVID virus has clearly shown that we can't take a one-size model approach for everyone. We have to do an individualized approach if we truly care about equity.
And I'd add one other thing too, going back to this, there are like, to me, levels of inequity when we're thinking about the special education population. Special education is such a hands-on approach. Imagine now being a working parent who has your special education child at home, who's getting this access to digital learning. There is so much now that's required of you to be that teacher's assistant when you're getting this virtual learning. And if you don't have the time to do that because you have got to go to work, maybe you're an essential employee, it just compounds the inequities. So.
Thank you all. Another question I'd like to pose before we move forward. We know that schools provide a number of services to students, and I'm wondering if you could discuss mental health services and what resources might be available to students now that the physical schools have closed.
Yeah, I'll jump in. I think, one of the things that I never considered doing before COVID was doing telehealth. Just logging on your computer and having a discussion with a doctor about something that ails you and it's not an emergency. What we have seen is there actually may be a better approach to counseling services in our school system than your traditional, and I think perhaps, archaic approach, which is to have a physical body in a school who serves as a counselor to provide mental health services, or just general counseling services to our students. We have a big disparity when it comes to counselor to student ratio in DISD. For instance, in high school, for every 400 students, roughly, there's one counselor. So if you need someone to talk to, or you need someone to talk with, to work through your issues, you're likely not going to get that in the way that it was ultimately intended when the counselor system was established in schools. But telehealth is a new approach now that I think we, at least in Dallas, are going to consider, because we have seen that it's a pretty easily accessible tool that we could easily plant within our schools. So again, I can't say that we've done a great job or that we'd even plan to do a great job around mental health services, because we were just trying to figure out, how do you teach a kid to read on a computer? But I think it's been the thing that we've learned the most about in such a short amount of time. And we, in our school system, are planning to potentially do a $3.7 billion capital bond. And it's likely that we will see additional money spent on telehealth services to do just this, provide mental health services for our kids in a more efficient way.
And once again, I think this shows that these are services that probably all students should have had from the very beginning. How can I expect you to learn to read or to write or to do math when you're worried about the trauma that you had at home? It's like just patently unfair. And I think we can look across the disparities between many of our big cities to small towns or rural areas to the suburban areas and see that some had these services and some did not. And after this particular case, months and months of isolation, of stay-at-home orders. I know that's what we had in Connecticut and being outside of New York City, with varying degrees of space for folks, whether it was, once again, it's a suburb of New York City. There's a lot of times you may have 4 or 5 people in a 1-bedroom, 2-bedroom if you're lucky. Now that it's getting hot, you can even imagine more how much stressful that is going to be if you don't have access to things like air conditioning. You can't get out to go to camp or to go shopping where they have air conditioning. If you don't have that, and now we still have to have you go learn, once again, that's not even fair from the very beginning. It's not fair from the very beginning. So we're going to have tremendous investments into mental health if we are truly, once again, concerned about all students doing well.
Sure. Thank you both. Oh, sorry. Go ahead, Stephanie, please.
Yeah, I just wanted to say that I think that mental health for schools is something that has been on the radar for the last several years. That there's also so many other things on our plate that it's really hard to try to make room for another thing. But we really, in David City, have committed the last 2 years. You do have your general counselor, but we went ahead 2 years ago and started contracting with an outside counselor for specific mental health needs for our students, because our guidance counselor just wasn't, and guidance counselors in general, they don't get educated in a lot of the same types of helpful measures that mental health counselors get educated in. So we initially 2 years ago, we invested in a counselor and we had to expand her services last year. And we only got, 3/4 through the year. But one thing we found for the closure was that students, obviously for obvious reasons, did not want to talk to the counselor or the mental health counselor while they were at home, where the parents or maybe the people that they were wanting to talk about were there. Or, there's a lot of instances where our counselors would call, they would know that there might be an issue in a home, and maybe they'd call and it was just really hard to communicate because they knew that that the student just wasn't in an area where they could share either physically or mentally, that they just couldn't get there. So we have a lot of concerns about that if there is any other future closure, but also just that communication barrier, taking a couple steps back for that quarter that we missed, and the relationship that some of those counselors created with those students. Having to rebuild some of that starting next year is going to take some time too.
And Jacqueline, I just want to build really quickly off of both what Stephanie and Q mentioned. Yeah. What now do you think has happened that we have placed kids back in homes and said, you can't go out and you must, stay within the physical confines of your home for the most part? I mean, it's essentially what we're telling people to do. Domestic violence has gone up in Dallas. It's a trend that's happening across the nation. Child abuse has gone up in Dallas. It's a trend across the nation. So again, compounding inequities that have manifested from this thing, but that has been one that's been eye-opening, at least to me here in Dallas.
Thank you all for sharing this information. I, in light of everything that you've put forward and have shared about, I wonder if you could give us some historical context here, just to help us understand how we as a society have gotten here. Christine, I think we have some slides we can pull up now. And Miguel, I'll turn it over to you to start the conversation, but I think having the context would be helpful.
Yeah, absolutely. So let me preface this by saying that, the slides that I'm going to show are certainly not the total answer to your question. It's a huge question that I think we could spend an entire session or a couple talking about and still not get to perhaps even scratching the surface. but I can give you the Dallas context to get a better sense of things that we know were major factors in getting us to the point where we would have to distribute 6.4 million meals in just a few months and have to, basically buy 150,000 computers and hotspots to try to get kids access to the internet. So if you go to the next slide, the short of it is really policy. We got to this point through policy. And that policy was rooted in race, and that policy was rooted in racism. And we can go back and document the policy. I mean, I think you start with the inception of the nation and the establishment of the system of slavery. And you talk about, indigenous people who run from their land. So it's been since the inception of our country that we have been putting policies in place to hold particular peoples down. But if you fast forward to just the past century, there have been specific policies at the local, the state, and the federal level that engineered us to maps that I'm going to show you in a second. But I want to start with this map. And this map may not be, it may be something that you're aware of. It may not be something that you're aware of. This is the Federal Homeowners Loan Corporation map of the city of Dallas. So you're looking at the city of Dallas in essentially 1930. The Federal Red Line map was essentially one of many tools building off of things like racial exclusionary zoning, where you couldn't live in certain parts of the city due to the color of your skin or your income level. Race-based covenants, where you couldn't buy homes because of who you were, or you couldn't sell homes to people because of who they were. Where we placed our highway system, basically putting them in communities of color, and in Dallas, very specifically African-American communities. And many other policies, including the one that's the most relevant, I think, to our conversation, the segregation of our school system. In Dallas, even after Brown versus Board of Education, we didn't come out of our desegregation court order until 2003. But this map is the Homeowners Loan Corporation map. FDR in the New Deal basically passed a measure that allowed for people who were on the cusp of having to foreclose on their homes, or who wanted access to a home to be able to build equity to get into the middle class. He created this map with his Homeowners Loan Corporation division that essentially only gave home loans to people that were businessmen, white collar individuals, or Anglo-Americans. And so if you were in a green or a blue zone in our city, you had access to those loans, and you ultimately built the equity you needed to get into the middle class or stave off falling into a spot where you would lose your home. If you were in a yellow or a red zone, you were part of the working class, or specifically, if you're in the red zone, you were a minority, most specifically an African American. If you'll go to the next slide. That map was in the 30s, and this map is of 2010 in Dallas. And it's a demographic map based on race. It's a little difficult to see, but the green dots are our African American community. The orange dots are our Hispanic community, and the blue dots is our white community. And if you can just remember what that Federal Red Line map looked like, and you look at this map, the correlation is stark and strong. If you'll go to the next map. So in Dallas ISD, like I told you, 91% of our kids are federally impoverished. But I like to say there's a difference between being poor and po, where you can't even afford the O and the R. That's what this map is. It's an intensity of poverty map, and it shows you where the most intense poverty is, which is the red and the orange zones on the map. So the historical red lines also approximate the modern day intensity of poverty in our city. And to get to the answer to your question, Jacqueline, how did we get here? We got here through policy rooted in race and racism that led to decades of disinvestment and have resulted in concentrations of deep poverty where you're not going to have access to quality food. You're not going to have access to technology. One more slide. The next slide shows you what has happened specifically when you compare green zones to yellow and red zones. And it's nuts when you look at these numbers. But this is the structural disinvestment and the effect of it, decades later. If you go to the next slide, to get more specifically into technology, We essentially have got digital redlining that's happening now. If you'll go to the next slide, Dallas is the 6th largest urban city with the worst connection. And if you'll go to the next slide, this is what that lack of connection looks like in Dallas. And again, very similar to what those federal red line maps look like back in the 30s, with the red, the intensity being the darker shades of red, where you don't have access to that broadband. And it shouldn't be shocking to anyone, but if you go to the next slide, this is what it looks like from a food standpoint. So the areas in pink are essentially areas that lack access to food, and specifically healthy food, and the areas in blue are areas that have got concentrated resources in areas of food. So I say all of that to come back to this idea of COVID showed us, for those of us that weren't paying attention, what the inequities look like today. What COVID didn't show us was how we got to this point. And until we reckon with these compounding moral debts, specifically as an education system, we're never going to have a whole city. And while we may be able to provide laptops to kids and to provide healthy meals at the school, we're going to have to really do a lot more than that to ultimately ensure that every kid has access to the resources that they need to get the education that they need to have the same shot that a lot of us have benefited from in the past.
So Miguel had maps and everything to prove it, but I just was the reason I talked about that drive to Stanford was to kind of envision what I'm about to talk about. So in our urban center, so in Connecticut, that's Stanford, New Britain, Hartford, Waterbury. But the big ones are New Haven, Bridgeport, Stanford, and New Haven. I feel like I'm missing one. Anyways, in those areas, you have most of your transportation system. So all your metro line that gets you from New York City back into the suburbs or back into Connecticut, not taxable. You have some of our largest churches, not taxable. You have Yale, University of New Haven, Southern Connecticut University, UConn Business School, UConn Nursing School, UConn Law School. You have all the satellite campuses of UConn, all nonprofits, all non-taxable. You have the hospitals for all these areas, all what's getting concentrated in these areas, all non-taxable. You have some of the best private schools in the entire world, all in these urban centers, all non-taxable. And then you have a lot of our most wealthy working in these spaces. So working in the university system, working in the hospital system, working in all these, great paying jobs, but living in the towns that I talked about that I had to drive through that are completely unaffordable for most of the families that still live in the city to go to. So what you have seen is wealth that was created in urban centers, taken out of urban centers, invested in their own small suburban areas so they can have great public schools there. But in the urban areas, now that we've taken away literally 60% of the taxable property, because they're hospitals, churches, other nonprofits, universities, so on and so forth, only 40% of it is taxable, and now they have to run their entire system off of that. And oftentimes in education systems, your budget is about, your education budget is about 50% of your entire budget. So now you have to run 50% of your budget when you can only tax about 40% of the property. That right there will relay and help you kind of give a framework for understanding why we have the inequities that we do, because essentially we have taken tons of resources out and we have never invested them back into our urban centers.
The only thing that I want to add to that discussion, and I think it's very interesting for Q, the very last thing that you said, the way that public education is funded in the state of Nebraska is completely through property tax. And in the state of Nebraska, it is the agricultural base that produces that money for the state. And so we are in the absolute, I feel like it's not opposite, but it's a lot of the money is being taken from the rural part and the relative rural poverty portion of our state and it's being invested in the urban areas of our state because they have the majority of the students. We have 67% of the state that is producing the money for 67% of the students that are located in the urban areas. But what that means is that the rural districts, they're struggling to provide an equitable education on all fronts compared to their urban counterparts. So that's the only thing I'll add. And I just think that that was an interesting dynamic between the two.
Yes, thank you. So we've identified the challenges we're facing now. What can we do moving forward? In what ways, big or small, can anyone from an elected official to the constituents they represent get to work to address these issues that we've all discussed today?
So I can start with some of the macro issues, right? And this is what I was kind of trying to lead before. If you're not talking about having livable wages and raising wages, then we're not talking about the inequities in our school, right? If talking about the digital divide, just as if there's not enough connectivity or computers in the home, without saying that families can't afford the bills for getting online or affording a computer, then we've missed the point. So we have to figure out why aren't folks having it. So one, we got to raise wages. Two, if we're not talking about the unaffordability of housing, if we're not talking about that, then it's really hard to talk about education, right? If we don't have enough money to pay for just to live, then we can't have enough money to be able to educate. So we have to look at our housing. We have to look at our health. If you can't breathe, if you literally can't breathe because of things like asthma or complications with COVID that you caught most likely from being an essential worker at work, you've already, once again, we're asking the wrong questions. So I think we have to look at a lot of these macro issues: raising wages, having healthcare as a right, not as a privilege, having access to affordable and clean homes. These are all the things that we're going to have to work on if we run education in our schools. And I would say the last one, that's a major kind of a macro change, is looking at education as an individualized system versus as a one-size-fits-all. Because we have to remember that when the system was created, it was essentially created for white men to teach their white boys that would one day be landowners. We had a minor shift in the 40s when it was during world time in order to produce producers. But right now we are in a time where creativity and problem solving and critical thinking need to be put to the forefront and not widget making. And we haven't made that transition yet.
Yeah, I'll jump in next. So, and I see Lucy, it looks like Lucy Okumu asked a similar question. What are some disruptive ideas? I think that, let me just choose right. If we don't think about this from a macro standpoint, then you can try all these little widget things, but whether they're gonna have a systemic impact is debatable. But as I think about like stepping into this world of taking the macro and then figuring out how you program the macro, I mean, one easy thing that we could do, and I am happy to say that in Dallas ISD, we are looking like we're going to do, is the school system is ultimately going to step into the role of, policy engineer for communities, and we're going to provide broadband universally to any child who goes to our school system. We're going to pay for it. And it's so it will be manageable from a family standpoint. And we're going to ensure also that our kids have access to that computer so that they can connect and that their families can connect as well. It's like that's an approach that we're going to take that has not traditionally been seen as a school district function. Another thing that we are working on, we created something called the Community Resource Index. When I showed you the map of the federal red line, those were intentional decisions made by policymakers to pick those communities. And they said, you will not be able to be advantaged by these programs. So we're reversing that thinking. And the Community Resource Index has gone back and it's essentially created a tracker of disadvantage broken into 5 major categories, a lot of which Q just talked about: housing, the criminal justice system, education and access to early education, and a few other things. And we have broken down, based on every single campus with a 2-mile radius around it, what disadvantage looks like in that community. And then we've also rank ordered all of our campuses to see what is the most disadvantaged communities. And shocker, the schools that were in the federal redlined areas, they end up being the most disadvantaged campuses. But now that we've got the data repository, we can be much more targeted in trying to fill in those gaps with those communities. So we're going to be retrofitting our campuses to have medical centers on our campus in areas where there is a health desert. We're going to fashion grocery stores to our campuses in areas that don't have grocery stores. We're going to provide access to nonprofit lawyers who work on tenant law to ensure that areas where we see high eviction, that our families actually have access to pro bono lawyers to work on the eviction process so that they have stable housing. So that's another component. But then the last thing, and then I'll be quiet because, again, I love this stuff. I can go on for days, but the basics. Every kid who has not had access to the highest quality educator should have access to the highest quality educator. And so we've recreated our evaluation and professional development system to ensure that we can identify the most effective educators, pay them the most, and pay them additionally to go into the schools that have suffered academically for far too many years, which again are in these areas that we know were fashioned to ultimately function the way that they function today. So those are some general disruptive ideas that we're working on in DISD that I think are a path to reconciliation and, honestly, reparation.
And I have to say for schools in general, I think that the last couple hundred years is proof enough that schools in general are a very incremental change kind of organization. It is we love change. We're all about, changing different programs, we want to try to get better. Schools are there to be change agents for society and for communities. We're there to educate people on all different things. But it's also very difficult to make that change happen and to make it stick, not just happen for 1 year, but to change a culture, not just within one school district, but within a state, within a region, within the whole country. But it's people like Miguel and Q that are going to be those second order change agents, right? The ones that have to go in, and you do have to do those sweeping changes. And those are very, very difficult because they require effort, and they require a lot more effort than what a lot of people are willing to put in because they want to see results now. But it's a long-term strategy in order to get that to happen. And one of the other questions was, are taxpayers going to be willing? That's up to them, right? It's their schools. It's their children. So what kind of future are you wanting for your children, and what are you willing to invest in? Because I think for us, we're constantly thinking about it's a payment, it's a tax that the schools we have to pay for our children to go to school. And while that's true, it's also an investment in what kind of society do we want to live in. And so you have to be willing as a taxpayer or as a parent or as a community member to voice exactly what you want your school and your community to be about and what you want them to teach your children. And so that's something that we can all do as an individual and as people who are looking towards the future.
And may I add on to that? Because I think they nailed the point about shared liberation. And I said, as a member of the finance committee, if I don't talk about taxes, then I feel like I didn't do my job. And I think the inequity map that Miguel showed illustrates it. But in my home state of Connecticut, the city of Stamford is surrounded, a fairly poor city. It's surrounded by New Canaan, Greenwich, Darien, and Fairfield, some of the most affluent areas in the entire world. Hartford, tremendous amounts of poverty, is surrounded by Avon, Glastonbury, Simsbury, West Hartford, so on and so forth. Tremendous amounts of wealth. New Haven, same thing. If we continue to fund our school system at the local level, we will have the disparities over and over and over again. Until the results of Greenwich are tied to the results of Stanford, until Hartford's results are tied to, and financially tied. There has to be a financial incentive because we can't wait for morality to do this. I think there's more than enough folks that say we want to do this. but will they put their wallet, will they put their to be frank, their property value on the line to doing so? That's what's going to take us over the edge to making sure that we have real equity. And the fact of the matter is, an investment in education is good for your property value. So there's actually a financial incentive to do this beyond what I would say is a moral authority and moral responsibility that we need to do this work.
I could talk and listen to everything you all have to say for the rest of the day, and probably the rest of the week, frankly. Somehow, though, an hour has already come and gone. And so, Stephanie, Miguel, Q, thank you so very much for your time and for sharing this very important information with us today. And, thanks also to all of you who joined us online. We hope to see you again next week. We are going to continue this conversation, and for more information, please follow us at ACYPL on Facebook, Twitter, and Instagram. But, just thanks again for tuning in, and really looking forward to continuing this conversation. So thanks for your time, and take care, everybody.
Thank you.